my life has been robbed from me. If you don't have your health, you don't have anything.
These are people who jogged, who went to the gym, who worked high-powered jobs, or just, enjoyed an early retirement. But they weren't these frail people they describe. And now they have been sick for months.
For Brut, I'm going to take you to the first COVID rehab center in New York City for long haulers, or people with long-term COVID symptoms. There I met Jody Brut, who's still having serious health problems 7 months after she was infected with COVID.
They call it paresthesia, which is basically, it's like pins and needles, but a burning sensation in my hands, and then it moved up my arms, up my shoulders. This has been going on for almost 3 weeks now. Shoulders, back, neck, top of head, and all through my back. And it's been excruciating. Prior to COVID, I've had incredible health. Pilates 3 times a week, cardio 2 or 3 times a week, running my own business here in New York City for 10 years, high functioning. I would give everything I have to just have my health back so that I could be a member of society and not feel like a burden to my friends and my family, to not feel like a guinea pig to the medical community. This virus is not to be messed with.
In, 2, 3, and let it out gently. Things like breathing exercises are a staple of our program. Gentle exercises like Tai Chi and Qigong, yoga, meditation. Initially, we thought that COVID was a respiratory illness, but with COVID, it's kind of like a heart condition superimposed on a respiratory condition, superimposed on a GI condition, and it's really the kind of thing where you have to meet the patient where they are that day and moment by moment. One of the things that we found with COVID as compared to other conditions like heart disease, like lung disease, is that there's a very kind of narrow threshold for error. And what I mean by that is that sometimes a patient could do 3 minutes of walking, 4 minutes of walking, but sometimes they go just a little bit over to, let's say, 4 minutes and 15 seconds of walking. And that might be enough to set them back.
His research into long-term symptoms is just starting, but he's already seeing some signs of improvements with patients.
It doesn't really feel that difficult, like the actual working out. It's afterwards that feels different. Like this past week in between, I have only used my inhaler, I think like twice, which is a big improvement from before.
I think of all the people that are, 20 to 50, they're not the grandparents sitting at home that you would expose. Some of them will have to change everything they dreamt about in life to adapt to make a new life.
With the new surge in cases, Noah told me he wants people to take COVID-19 more seriously.
For the ones that don't know COVID, don't know anyone who's died, don't know anyone who's been seriously affected by it, it's easy to say, I don't want to wear a mask. But for anyone who's lost a family member, lost a friend, or has somebody in their lives that is still suffering months after the acute symptoms have gone away, and months after the virus has gone away, you'll never forget this for the rest of your life. And it's very traumatic. But my hope is that as a nation and globally, we will come together to try to eradicate this virus.